Welcome to Thursday's edition of COVID-19. Korea's daily tally has soared to yet another high just one day after, marking a record level. Now, we have details on that later on in the program, as well as a look at the resurgence here and elsewhere. We start now with the pandemic updates with our Kwon-soa. Now, Soa, let's begin here on the local front for this Thursday.
Sure, Sunny. It's the first time that Korea has surpassed 1,800 infections. And as Sunny mentioned, it's the second straight day that Korea is posting a record high in daily infections. And also for the second consecutive day, over 500 cases occurred outside the metropolitan region. So 1,842 is the record-breaking figure we're seeing as of 12 a.m. this Thursday. But there's actually been a decline in domestic infections of over 190 compared to yesterday, but we're seeing this unprecedented figure of imported cases, and this because 270 cases from a mass outbreak on a South Korean naval vessel have been added to the tally. Now, one additional case was confirmed this Thursday that's expected to be tallied in tomorrow's infections. So with that, Korea has surpassed 184,000 infections in total, and for the 15th straight day, cases have been at above 1,000, and here you can see the past week's daily tallies. Also, the capital region this Thursday has seen a drop in infections in all three of these places, Seoul, Incheon, and Gyeonggi province, but we're seeing a rise outside the capital region, including in the center of the nation and southeast, with Busan in the triple digits for the second straight day. Now, 35.6% of cases have now occurred outside the densely populated metropolitan region, which is raising alarm bells across the country. And which is also why more and more places have decided to raise the level of their social distancing measures, including Daejeon, which as of this Thursday has raised its level to level 3, and Sejong City to level 2. Now, the metropolitan region is expected to be under level 4 for an extended time. We will have more details on that with our Jang Tae-hyun in a bit.
Right. Meanwhile, on the international front, concerns are mounting in neighboring Japan ahead of Friday's opening ceremony for the Summer Olympics. And the Delta variant, I understand, has made its way to more countries this week.
Right, Sunny. First off, while the opening ceremony for the Tokyo Olympics kicks off in just a day now, Japan has recorded its highest caseload in around 2 months, with some 5,000 infections posted on Wednesday. And Tokyo accounted for over 1,800 cases alone, and that marks a 7-month high. Meanwhile, the highly contagious Delta variant, also making things difficult in Japan and here in Korea as well, is expected to become the dominant strain in the world, according to the World Health Organization. In its weekly epidemiological update, the WHO said in the past week alone, the variant that was first detected in India has been reported in 13 more territories, bringing the total to 124. The organization noted that the variant of concern accounts for more than 75% of cases in several countries, including India, Bangladesh, Indonesia, the US, Russia, and South Africa. Strains that were detected earlier, the Alpha, Beta, and Gamma variants, have been reported in 180, 130, and 78 territories each. And some countries that are struggling due to the Delta variant are the US and also the UK, which has now surpassed Turkey in total infections, reporting over 43,000 cases in the past 24 hours. And the total amount of cases around the world now stands at 192.8 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for that. Right, the current level 4 restrictions here in the Greater Seoul area are poised to come to an end this coming weekend. And for more on the future course of social distancing in the region, I have our Jang Tae-hyun here in the studio with me. Welcome, Tae-hyun.
Hi, Sunny.
Right, so chances of an extension of the COVID-19 prevention measures here are high.
Right, Sunny. So this comes amid a warning by health experts that the country's daily caseload could surpass 2,300 by early next week. And they're pointing to the spread of the Delta variant as the cause, along with more people traveling nationwide for the summer vacation season. Korean health authorities say that they'll announce whether to extend the current distancing measures being enforced in the capital area by the end of this week. As it stands, those guidelines are due to expire on Sunday. The government also announced a set of new guidelines on Wednesday, banning concerts and other events at makeshift venues in areas outside the capital region.
다만 거리두기 단계가 낮은
Under current distancing rules, large concerts at temporary venues like gyms are allowed to be held in areas outside the capital region, which led to concerns over the possibility of a mass outbreak. In response, prevention rules that are currently in place for the capital region will also be applied equally elsewhere, starting July 22nd to August 1st.
Currently, a ban on gatherings of 3 or more people after 6 p.m. is in effect in the capital region, but the government is considering the possibility of applying that same rule on a nationwide basis.
I see. I suppose a sense of consistency may prove productive. Meanwhile, Taeyeon, on the vaccination front, what is the latest with regard to appointments for those in their 50s?
So as of Wednesday at 12 p.m., 64% of eligible recipients, so those aged between 50 to 54, have registered for the shots. The latest round of bookings for that age group kicked off on Wednesday evening. However, the process has been marred by technical issues on the booking site, and President Moon Jae-in on Wednesday ordered government officials to resolve the issue. Millions of people looking to book their vaccines were left frustrated as the website repeatedly crashed due to server overloads. In other related news, Korea is reporting more breakthrough infections among people who have been fully vaccinated for 2 weeks or more. As of July 19th, a total of 647 breakthrough infections were reported in the country. Of them, 364 had received the Janssen vaccine, 145 Pfizer, and 138 got the AstraZeneca jab.
Janssen vaccines here in Korea were mainly distributed to young people, and a large proportion of recent COVID-19 cases came from that particular age group. This goes to show that breakthrough infections can occur in anyone, no matter which vaccine they received. It also appears that the sheer number of recent cases in that age bracket naturally corresponded to more breakthrough infections.
Meanwhile, a team of researchers from New York University found that the Janssen vaccine is less effective against the Delta and other variants. This is in contrast to a recent study conducted by Johnson & Johnson, suggesting that Janssen vaccines provide strong protection against variants of all types. The NYU research recommends that Janssen recipients get a booster shot of either the same vaccine or other like Pfizer and Moderna.
Right, I see. Now, before you go, Taeyeon, I understand efforts are being made to ease the physical challenges brought on by the blistering heat at temporary screening centers.
Sure, Sunny. So as you know, summer is in full swing, and when you go outside, the temperature is sizzling right now. So health authorities are advising medical workers to wear more breathable protective gear. Also, Seoul's Seochogu district office is handing out free parasols to help citizens stay under the shade while they're waiting outside to get tested. To prevent dehydration and heat-related illnesses, coolers filled with ice-cold water bottles and are also available at these sites.
What they're doing here is great. I was able to wait comfortably because of the parasol and water.
Giant fans and mobile air conditioning units have been installed to keep frontline medical workers cool while they work in full protective gear. In Gangnam-gu district, a community health center there has adopted a quick registration system using QR codes to cut the waiting time for people lining up outside.
We realised a few things that aren't really working well for people, as we've been conducting COVID-19 tests for a year. In the past, people used to register their information on paper, but we introduced a QR system to test people more quickly and safely.
Health authorities say they'll adopt flexible operating hours for test centers when a heat wave advisory is issued. This would occur when the temperature exceeds 33 degrees Celsius, in which case the test centers will be closed on the hottest time of the day from 2 to 4 p.m.
I see. All right, Taeyeon, as always, thank you very much for the coverage.
Take care.
Right, and it's time now for the afternoon briefing for this Thursday for the COVID-19 situation here in Korea.
And in the metropolitan area, for the past week, we have seen about 980 cases, and among the total cases, we are seeing this account for about 69%, and we have seen a recent drop in the total proportion. On the other hand, we have seen about 442 cases in the non-metropolitan area, which is more than 39%, and we have seen a slight increase in the proportion. And next, as for the vaccination and also the booking, here are some details. As of now, we have about 32.3% of the population receiving their first dose, which is over 16 million here in South Korea. And we have 13.1% of the total population being fully vaccinated, standing over 6.7 million. And also starting from this week, we have been rolling out vaccines to high school seniors and faculty members. And they have also, their vaccination is also underway right now. And as for the age group between the ages of 50 and 59, we have also seen about 80% finishing up with their vaccination booking, and about 72% of those in the upper age group of the 50s. And also today, we have more than 520,000 doses of the Moderna being arrived here in South Korea. And also by late August, we will also have about 30 million doses of the vaccines to arrive in Korea. And as for the details, we will be disclosing the details as soon as we have some agreements made with the drug maker. And also starting from July, we will be giving out Moderna vaccines to those over the age of 50. And we also will have some detailed guidelines for any adverse responses. Here in the country, we have given out the vaccines, the Moderna vaccines, to about 640,000 people here in the country, centering around the medical professionals. And we also have seen that Moderna vaccines have been about 94% effective in the global research. And in Canada as well, they have also said that Moderna vaccine is also about 80% effective against Alpha variant, and as for the Delta variant, it is about 72% effective. And moreover, after the first dose, we also have had some effects on reducing the death as well, and about 75% for Alpha variant, and about 96% against the Delta variant. And next, as for the safety vaccination for the Moderna, here are some responses against any possible adverse responses. All of the recipients need to stay at the vaccination centers for the next 15 or 30 minutes. And after returning home, they need to monitor their conditions for the next 3 hours. And also for the next 3 days after inoculation, we ask you to monitor your situation and condition. And if you have any fever or other symptoms, please visit a doctor as soon as possible. In particular, as for Moderna vaccine, if you are seeing any clinical symptoms of pericarditis or myocarditis, or if you have any facial fillers, if you have swollenness in your face, then you need to immediately visit a doctor. And as for the hospitals that have seen such patients, we ask you to report to us as soon as possible. And as for all mRNA vaccines, these are prone to rare cases of heart inflammation, so we ask you to take particular precautions. After receiving the Moderna vaccine, if you experience chest pain or difficulties in breathing or heart racing, we ask you to also monitor your situation and condition. Or if you see such symptoms become more severe, we ask you to visit a doctor as soon as possible. And all of the doctors who have been seeing such patients, we ask you to report to us as soon as possible. And the global outbreak of the COVID-19 is as follows. And we have seen the tally increase for the past 4 weeks. And this is due to the Delta variant spread. And even in countries whose vaccinations rate stands at over 50%, we have seen a rapid increase of the new numbers. And also we have seen some increase in the number of weekly tally. As for the statistics revealed by the WHO, and they say about 3.4 million cases have been breaking out for the past week. And UK and Israel as well, we are also seeing a surge in the number of cases, and especially for those imported cases who have already been fully vaccinated, they are seeing a Delta plus variant. And in Germany, we are also seeing an increased detection rate of the Delta variant, which is also fueling up the number of cases in general. And as mentioned before, here in South Korea, we are in the middle of the fourth wave of COVID-19, and we have seen a four-digit number above the 1,000 mark carried out for the past 15 days. And in the non-metropolitan area and regions outside the capital area, we are seeing continued increase. And in venues related to our daily lives, including restaurants and office spaces, we are also seeing increase in the number of infections. Right now, it is very important that we have concerted efforts to carry out social distancing measures, and this is the only way for us to contain the virus and prevent a medical collapse. The quarantine authorities will carry out testing, tracing, and also treatment.
네, 그러면 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 출입 기자단 그룹.
Right, that was Baek Young-taek with Thursday's afternoon briefing. So what did he have to say?
First of all, the average of daily domestic infections has been on the rise, standing at around 1,426, and that's a rise by 9.5%. And in the past week, some 69% of cases occurred in the metropolitan region, which means 31% outside that region, which represents a rise in the non-capital regions. Meanwhile, on the vaccination front, the official mentioned that more than 50% of senior high school students and instructors at high schools have been inoculated now. That's around 326,000 people. And the reservation rate for those in their 50s from 55 to 59 stands at 83.2%, and those from 50 to 54 at 72.3%. He also mentioned the increase in infections across the world, saying that cases have been rising for the past 4 weeks, especially with many countries affected by the Delta variant as well as the Delta plus variants, mentioning countries like the UK and Germany, and also stressing that Korea is currently in the midst of the fourth wave, which means, of course, that we have to stay vigilant.
Right, and get ourselves vaccinated, right?
Yes.
All right, so thank you for that.
Thank you.
개인적인 전파든 확진자 간의 접하이든 아니면 집단 감염 사례이든 기여하는 부분은 점점 더 높아질 것이고 델타 변이의 그 점유율, 그 우세 변이화가 되는 것도 점점 더 가속화될 것으로 이렇게 보고 있습니다.
The fourth wave that began here in the metropolitan region is now taking root in different corners of the country, raising concerns over the effectiveness of current containment efforts and future trends in light of the summer holiday here. For more, I have Professor Kim Sung-hae from Hanyang University. It's a pleasure to have you back, Professor Kim.
Nice to see you again.
And joining the session virtually is Professor Shimana at Sungchil University, who's currently in Canada. It's good to see you again, Professor Shim.
Thanks for having me.
Right, Professor Kim, our daily tally today has hit a fresh high with over 1,800 infections. But imported cases account for slightly over 300 of those cases. And when we compare the local infections, today's figures, to yesterday's, that would be Wednesday's, we see a decline of 200, almost 200 that is. What are your thoughts?
So you want me to say that it's not really fast increasing?
I'm not sure, but I'd like your honest opinion about the trend then.
Considering the number of imported cases. But overall trend over 7 days, it is going to increase. It's going to be increasing again. And there should be some fluctuation on a daily basis, but it's not like that it's increasing again. There should be some small waves. So that's why it looks like that it may be decreasing quite soon. But I think Professor Sim, she will have an answer, but I would definitely say that overall trend, it's increasing.
I see. So as a medical expert, you expect these numbers to continue to be on an incline in the coming days then?
Yes.
I see. Professor Shim, before we continue to address concerns here in Korea, perhaps you could tell us a bit about the COVID-19 situation in Canada as well.
Sure. So COVID-19 situation in Canada has been pretty good recently, mainly because they were able to achieve a pretty high vaccine coverage levels in Canada. So cases have decreased by 25% from the average 2 weeks ago, and the number of deaths have decreased by 50%. And in Canada, actually, 70% of the population has received at least one dose of a vaccine, and 50% of the population are fully vaccinated. And I think it just shows the importance of vaccination when we try to control COVID-19 pandemic.
Right. Now, Professor Shim, as a member of Korea's COVID-19 Mathematical Modeling Task Force, what are your findings with regard to the future course of this fourth wave here in the country?
Yes, we have entered the fourth wave of pandemic, and the Delta variant has emerged as the latest hurdle right now. And we estimate that the effective reproduction number with the Delta variant is about 1.3 as of this week. And I think that our model predicted the Delta variant will soon take over in the country and is on the track to become the major strain in summer. And using our mathematical models, we predict that if the current situation gets worse and social distancing measures are relaxed, the daily caseload could reach 3,000 by the end of August. And this is because Delta variant can potentially increase the caseload up to 3 to 4 times higher than in the scenario without the variant, as our study showed.
I see. So the future is looking quite bleak then. Yes. Right. Meanwhile, authorities in Netherlands have also reimposed restrictions amid a resurgence fueled by the Delta variant. Now, for more on the situation there, I have Justine Swab live on the line. Justine, welcome.
Welcome. Thank you.
Right. Now, Justine, do tell us, do start that is, by telling us a bit about the resurgence in the Netherlands.
Right. Well, it's at the moment, it's about 4 out of 10 people that are fully vaccinated in the Netherlands. There's been a reopening on June the 26th, if I am right. But the measures have mostly been ditched. Since then, there has been a great research. So about 500 people were infected when there was a reopening. A few weeks later, about mid-July, there were 10,000 cases of infections.
I see. And in recent days, Justine, have the cases been surging or falling? Because I understand that you've been seeing cases above 6,000 on a daily basis in the recent few days. Is that correct?
That's correct. Yesterday, there were 7,000 cases, which is actually a downward trend. But the hospitalizations have gone up, and there's now 124 people in the hospital.
I see. Which is why authorities there in the Netherlands have reimposed their restrictions. What are some of the restrictions in place there, Justine?
Well, the nightclubs have closed, as well as live events. There's still a mandate for masks in public transport, but unfortunately, say experts, mask wearing has otherwise in public and in inside spaces has not been implemented anymore after the reopening.
I see. Meanwhile, Justine, what is the response of the public to the reimposing of restrictions, especially given the fact that other places like England have lifted their restrictions?
It's been very mixed. All throughout the pandemic, the public response has been quite polarized. there has been an outcry, and some people even felt a little bit insulted, especially young people who received the Janssen vaccine and who by the Ministry of Health were invited to, under the name of Dancing with Janssen, which rhymes in Dutch as Dans bij Janssen, to go out and party. Now, for instance, there was one festival in Utrecht where 1,000 people were infected. It was an outside festival, but there were also some indoor, under a tent, events there. And this seems to have attributed to the research. So these young people have felt misled, and they might even be able to claim basically, if there will be a court case, damages from the state if they get long COVID.
I see. And staying with the young people, Justine, what has been the response among them with regard to vaccination efforts of the country?
Well, it's been mixed, but overall, young people do want to get the vaccine as they need it to be able to go to festivals, nightclubs. But unfortunately, after the reopening, there had been also a lot of fraudulent entries. For instance, people copying each other's QR codes or vaccine passes. So this also attributed to the research.
I see. Meanwhile, Justine, I understand that you survived COVID-19 yourself and are currently experiencing long COVID. Could you share your experience with us?
Yes. So my infection was around February 2020. So it's already been 1.5 years ago. I had multiple organ system failure, which one of them was inner ear issues, which made me have severe vertigo attacks, which would last up to 2 weeks. That was extremely debilitating. But for instance, I also have the typical chronic fatigue. For instance, also trouble with word call, which you might notice that I can have trouble with word recall, brain fog, other issues. So it's been quite a long road and quite debilitating, which has also led me to have issues with being able to work.
I see. Justine, is there a support system in place in the Netherlands, perhaps, to better assist people like yourself who continue to combat the after effects of COVID-19 infection?
Well, that's only starting to pop up. There are long COVID polyclinics, but unfortunately, what you see actually everywhere in the world, there have not been many GPs that always take the patient seriously, of course, because there's not that much known yet. Luckily, we know more and more about long COVID. But in my case, there has not been much support, as it's not been recognized as I had my infection when there was no testing. 7 months later, I could get a test, but then the antibodies already probably left my body, so I can never prove that I had the infection. But it really looks like it was the problem because all my issues started after a flu.
I see. All right, Justine, now do take care of yourself, and thank you very much for making the time to join us live at this very early hour.
Pleasure.
Right, then back here in the studio, Professor Kim, genetic analysis of 2,381 infections last week found nearly 40% of the Delta variant. What are your thoughts on the pace of the spread of this variant here on the local front?
We have around 40% as of now. Globally, the Delta variant occupies around 2/3 of the all population, all infection. So it depends on how many cases we have. The more cases we have, the Delta variants will transmit faster. But when you think of our daily number of cases from 1,500 to 2,000, does it comparable to other countries with full of Delta variants? Not yet, but it will grow because our number of cases are growing as well.
Right. Professor Shim, I understand this is an impromptu question, but what can you tell us about the spread of the Delta variant over in Canada?
Well, yes, Delta variant is far more transmissible, and we estimate that the basic reproduction number for Delta variant could be between 5 to 7. And with this transmission potential of Delta variant and vaccination plan, it's important to vaccinate the majority of the population before they emerge and start spreading out. So in that sense, Canada has some advantage because we already vaccinated the majority of the population. But it's just to show the importance of having population vaccinated even before Delta variant becomes more prevalent in the country.
I see. And staying with that, Professor Shim, I hear you've also sought to look into the impact of the spread of the Delta variant on Korea's efforts to reach herd immunity this November. What have you found?
Yes, with this transmission potential of the Delta variant and current vaccine rollout plans in Korea, I think it's very difficult to achieve herd immunity by the end of November, as our study showed already. So Delta variant has such a high transmissibility, and its R0 is between 5 to 7. So that means that 80 to 85% of the population needs to be protected to achieve herd immunity. That's a considerable jump from the original estimates of 70% earlier in the pandemic. And we have to remember that vaccine efficacy against the Delta variant is quite limited. It could be as low as 60% even after the second dose. So what does that mean? Well, I think that we are in the race with the new variant. The longer it takes to vaccinate the majority of the population, the more time this variant has to emerge and spread in the population. So it's important to vaccinate quickly and thoroughly before we have more Delta cases. And also we might need to consider including younger age groups into vaccine eligible population so that we can protect our adolescents and teenagers, especially when we're considering reopening school in September with in-person classes.
Right. And Professor Shim, based on your calculations, how do you respond then to a possible extension of level 4 restrictions for the Greater Seoul area in the days to come?
Yes, so if social distancing is relaxed, our model shows that the outbreak could increase explosively because there will be more person-to-person contact and more exposure at various social venues. So our simulation shows that with 10% increase in contact rates, there might be 20% increase in caseload, and even more if Delta variant becomes a major strain in summer. So during summer vacation, virus may spread further if the social distancing measure is relaxed. That's what concerns me at the moment. So we might need to extend the current social distancing measures unless we see some major drop in the Delta cases. And a similar decision has been made in UK as well, because last month, UK delayed the reopening plans by a month. So they were supposed to relax some social distancing measures on June 21st. And it was pushed back to July 19th because of the emergence of the Delta strain.
Right. Professor Kim, as a medical expert yourself, what are your thoughts on the level of social distancing restrictions needed, that is, to tackle the fourth wave here in the country?
It is very difficult to say that because we are already at level 4. Officially, level 4 is the highest level of social distancing that according to the government plan. But then also we have to look back whether we are doing well, because many people don't change their behavior. Whether we apply level 4 or level 3, the way people move around is the same. If you recall how we have been doing in early pandemic, in February, March 2020, a lot of companies have introduced the teleworking and remote offices. But these days, not many companies or even government offices, everybody is going to office, very few. I think universities or schools are abiding well compared to other commercial sector. But in fact, the study shows that the level of mobility did not change that much since we introduced the level 4. So it's two different stories. We have officially level 4, How much people abide by, that's another story. Are we really doing the level 4? Maybe not. So that's one thing. And what can we do on top of level 4? It's a tough decision for the government because it has a huge impact on the economy. So it will be challenging for the authority to move forward when we do have the officially level 4. There will be for sure resistance from the commercial sector, especially for the shop owners and micro business owners, because they have the hardest time during this corona pandemic. So we do need it. And as an epidemiologist, I would recommend to tough the measure, but we also have to think of what would be the consequences.
What are your thoughts, perhaps, Professor Kim, on adopting a uniform set of restrictions throughout the country? Because at the moment, as you saw earlier on the program, we have certain places under level 1, other places in level 2, we have the metropolitan region under level 4. Would it help to have one consistent system for the entire country?
Oh, that could be an option. That could be an option because it's a bit confusing. Because, for instance, I live in one province, but you may come out to the other province. So you may be in different zone. For work, I'm on the level 1, but at home, I'm on the level 2. So that has the issues for many of residents in Korea because, as you said, we have a lot of different polarized way of applying the social distancing. So that could be an option. And we could somehow more actively encourage people to take part in this social distancing. The level of asking action can be a bit more specific. For instance, whether you go to the office or not. These kind of things are not really openly told anymore. Because we have over the last 2.5 years, we have managed to find our own ways of complying this situation, and I'm very sure that a lot of people, they will not change their behavior and the way they move around according to what government requests to do. So that is the problem. Some has very strict implication. So small shop owners, they have to follow. They have to close at 10. University also we have rules. No university is open, but we have different policy for high school, different policy for middle school, different policy for elementary school. And as you were right, by geography, by sector, we have different approach. So it's an option to have a uniform approach because that will simply make people to behave in a more uniform way, but there should be some resistance in applying that. That's why we have evolved in this way, I think. I think this is the direction to have less and less resistance from the public.
Right. And keeping in mind what Professor Kim has said, Professor Shim, what can you tell us about the approach adopted by authorities in Canada to encourage members of their public to abide by social restrictions?
Well, we give some reasons to be vaccinated so that they can travel freely. So it's one of motivation to be vaccinated. And that's why the adherence to vaccination policy has been pretty high in Canada and kept that way.
How were they able to maintain that high level of vaccination within the public, do you think, Professor Shim, in Canada?
Well, we introduced vaccination pretty early in the pandemic, so there was one motivation. And also, they did a pretty good job in educating people about correct information on adverse events and the risk of infection if they don't get vaccinated.
I see. Professor Shim, on the vaccination front, staying with that, do you suppose then that the inoculation perhaps of more active, younger members of society would perhaps ensure less infection numbers in the future?
Yes, I think so. Our study showed earlier the same results, and this can be explained by the pattern of a transmission as well. So every time a wave comes along, we have observed that virus tend to circulate among younger age group first and make its way up to older age groups later and infect more. So, and this is expected because younger people, younger age groups have lower disease burden, and they have a large contact network. And this is why our study research show that the vaccine priority should be given to younger adults to minimize incidence. And I think it still applies to fourth wave of pandemic in Korea as well, because we want to cut the transmission route first. And now we have a stronger evidence to support our argument, because recently in UK study, they have shown that individuals under age of 50 are 2.5 times more likely to be infected with the Delta variant. So it seems that Delta variant is impacting younger age groups more compared to other age groups. So it's just essential to vaccinate younger adults as soon as possible, and if feasible, even prioritize vaccinating them to minimize the incidence, I think.
Right, and keeping in mind what Professor Shim has said, Professor Kim, as again a doctor yourself, what are your thoughts now on turning the priority to younger adults?
Oh, I fully agree with Professor Shim. And as she mentioned, the speed of vaccination is very important. It doesn't really work well if we do vaccination very slowly. Already studies from Israel shows that the efficacy of vaccine may walks away if we don't know, because we don't have all the evidence to say how long it will last. But after 6 months of vaccination, it seems like that already the efficacy is decreasing. So we should really doing the vaccination very fast, and fortunately we do have capacity to do the vaccination inoculation, so it all depends on the supply. And at the same time, that these days the mortality cases, the age group has been shifted. It's definitely for those who are in 40s and 50s. So our recommendation is definitely for authority to try to identify the vaccine supply to be faster than we have now, and then move forward from 50, 40, 30, 20 very quickly. And also to include the younger population, younger than 18. Because now we have new study showing the efficacy and safety of those who are adolescents. So that will help a lot to achieve the herd immunity.
Keeping in mind that the protection induced by the vaccines do not last a very long time, then Professor Kim, what are your thoughts on booster shots?
It may come. It may come. I have seen some of the cases from Thailand. They do have this Chinese Sinovac for 2 times, and now they are introducing booster for third shot. So some countries, they move very fast because they don't want to lose, and they don't have capacity to do a study. So then they quickly make a strategic direction to do it. But maybe our government, we're more patient, or we're more careful, because in comparison to global trend, our mortality is not very high, and we are sort of under control of this pandemic. So we have some capacity to wait until all the evidence comes out. But I think it is possible for variants or for some combination of vaccines. We never know. We never had this type of virus. We never had this type of vaccine. Now, we never thought that we would require more than 2 times of vaccination, but it's happening right now.
Right, we're learning more as we go ahead with this fight against COVID-19 then. All right, Professor Kim, thank you very much for your thoughts. And Professor Shim over in Canada, thank you very much for your time today.
Thank you.
Right, cluster infections continue throughout the nation. Remember to watch your distance, wear your face mask and wash your hands. Also, do seek testing if you believe you may have been exposed to the virus. Thank you for watching.